This sweet little hamster came in because she had some hemorrhagic discharge from her vulva, and upon further exploration we found out that she probably had an infection or potentially cancer in her uterus, so we recommended to get her spayed. She's a very well-behaved hamster, which made this process so much easier. So here we have her under a clear drape, so it's easier for our technicians to be able to see and monitor her breathing and keep an eye on her heart rate and SpO2. I'm wearing magnification so I can properly see her tiny little uterus and blood vessels. And we're, in this part, exteriorizing the uterus, which is that U-shaped structure there. Those are the two fallopian tubes on either side. And you can't see it very well because of how tiny they are, but she has two little ovaries, one on each side, that I am ligating under and cutting off the blood supply, checking to make sure that there's no residual bleeding after removing the ovary and the associated part of the uterus. And I'm using tiny little suture here. It's a size 5/0. So I repeat this process on both sides. The nice thing about hamsters is their ovary is very easy to identify, unlike some other small creatures in which it's quite difficult to exteriorize. So now I'm completing it on the other side, and the instruments I'm using here are from a microsurgery pack. The other very important thing during surgery is to be very careful with tissue handling. Any quick movements, or if I put any extra tension on these pedicles, they can rip very easily, and it's very hard to locate bleeding if there is any bleeding residually. And so while I'm doing surgery, she's being kept a close eye on by the techs. Her temperature is being monitored. We're making sure that her gums are nice and pink, that her SpO2 is normal, and that she is in the correct position so we can get a good Doppler heart rate reading on her. And now we've come to the part of surgery where I'm just ligating just below the cervix, and so we removed the entire uterus now. Took a culture swab of her belly, and we're just making sure nothing is growing in there. Now I'm closing the body wall layer. Now I'm closing the subcutaneous layer. And now I'm closing up the skin layer and placing some skin glue on top. And now she is awake from anesthesia, still quite a bit groggy, but doing really well. A few minutes later, she was wobbling around, showing some interest in food, but not really eating ravenously. Once she got her post-op pain medication, she seemed much more comfortable, was walking around, exploring, and she's just the sweetest little hamster. So I sent her uterus out for histopath, so soon we'll know what was causing that discharge and her discomfort. Stay tuned!